I'm Professor Myra Hunter from King's College London, and I'm going to be describing a cognitive behaviour approach to help people to manage hot flushes and night sweats. So CBT, as it's known as, for hot flushes and night sweats, can help people to understand how their cognitive and emotional reactions to these symptoms might affect their actual experience of them. It's a treatment to help you to manage the symptoms but not necessarily stop them altogether. We've been studying CBT and we've found that it is effective to reduce the impact of hot flushes in breast cancer patients. And it involves looking at the relationships between physical symptoms, thoughts, feelings and behaviours. So, for example, if at the onset of a hot flush, say in a work setting, you might think that you're unable to cope and that everyone's looking at you, then these thoughts are likely to lead to feelings of embarrassment, feeling loss of control and some anxiety. In turn, these emotional reactions can increase arousal and actually make the hot flushes more intense. If we feel embarrassed and out of control, there's a tendency for women to want to avoid the situations in the future or try to hide the hot flush when they're sitting in the situation. However, avoiding social or work situations can reinforce the message that you can't cope and that hot flushes are inevitably shameful and embarrassing. This is shown here on the slide, the negative cycle of thoughts, feelings and behaviours. So our message is, noticing and changing some of these unhelpful thoughts about hot flushes can be a good way of stopping this negative cycle. On this slide there are some examples of helpful and unhelpful thoughts, and you can see if any are relevant to you and if you can come up with your own. By doing so, the hot flushes can feel less threatening and less catastrophizing. We talked about calm-paced breathing. Now this involves slow, calm breathing from your stomach. You can focus your attention on the breathing, accepting that the hot flush will pass and let it flow over you. Adapting this calmer and more supportive thinking response to hot flushes may also help you to feel less anxious or frustrated by them, and it's very likely that they will feel less intense as a result. There's a paced breathing exercise in the resource section. Other components of the full CBT treatment include identifying triggers to hot flushes, reducing stress and improving well-being, and managing night sweats and sleep. So if you're interested in this approach, you can find out more in the resource section